And before I start, just a little disclaimer. The views and opinions expressed by me are my own, and they do not necessarily reflect those of my employer, colleagues, or any professional organizations that I am affiliated with. So any statements I make today are just for informational purposes and should not be considered official positions of any institution or entity. So these are just my views and my opinions, no one else's.
Welcome back to another Palm Wine Central podcast episode. I am one of your hosts, Uncle AK. Me, I got T, I got Tutu, I got Karla, I guess, today. But before we get to it, T, how you doing?
I'm doing good. How y'all doing?
Man, we have fantastic
Brother.
like you got on.
Say what now?
We have fantastic like that turtleneck you got on.
Okay,
like your shirt too. So you look nice.
The turtleneck is turtlenecking, sis.
You know what I'm saying?
Thank you.
So, how do you do?
I'm great. Can't complain.
How
Great.
where you left us last week and disappeared?
You said what?
I said, why were you complaining when you disappeared last week?
Why was I complaining?
Yeah, so why were you complaining when you didn't show up for your shift last week?
Oh, sorry. It was Dallas week. So I had to mandatory team building and quality time with my coworkers.
How did that go? We seen you on social, man. You know what I'm saying?
Oh yeah, y'all, it was really good. Like
You put on like 3 different makeups in one day.
oh wow. It was really good. Everybody came down from the show and we just like did a boot camp seminar on how we can improve the show and what we need to work on. And then I did a little tiki talk with Marvin Sapp and that like blew up. So that was really dope. So yeah, but it was a great week.
That's what's up. I'm glad you enjoyed yourself. But yeah, this is Palm Wine Central podcast. This podcast is about this podcast is about men and women, not just African, men and women in general, from different walks of life. We'll come together to discuss, share, and learn ideas, breaking the mold, different perspectives and stuff like that. So today we have a very special guest. It's Women's History Month, and part of this month, we bring on women to discuss different topics. Today's topic, HIV and AIDS. Not so much fun topic today, but you guys are in for a great one. She goes by Karla. She's an MPH, CHW, and HIV PNC. I don't know what those acronyms stand for. She will explain them to us. I did my due diligence to research them, but I think it will come better for her. So, with no further ado, welcome to Palm Wine Central podcast, Karla.
Thank you.
Let's start like this. I beg, break down your acronyms for us. I beg, first of all.
I know, right? She's the good alphabet.
Exactly.
So MPH stands for Master of Public Health, and that was just basically my graduate degree. CHW is a community health worker, and HIV PNC stands for HIV PrEP Navigator certification, and it's a certification that you can get when you work in the HIV space. And basically, it trains you to be able to help people navigate the healthcare system when it comes to getting them on PrEP. And PrEP is one of the prevention methods that are used to prevent HIV. And I'll talk more about that later. And it stands for pre-exposure prophylaxis.
Anyways, did I mention? Thank you for that. I can never pronounce the last word you just said. But anyways, did I mention she's a public health professional from Dallas, Texas? Not that it matters, but she has over 10 years of experience in HIV and STI prevention health. So again, this episode is heavy on HIV and STIs. So open your ears, open your eyes, your mouth closed, just smile, and then, let's have this conversation. So
yeah. And we're going to try to make it fun. So
yeah, for sure. I mean, you guys are here now. So I see two today. All looking like, let's get into it. Talk to us about your day-to-day as a public health professional.
Okay. So my typical work day, no day is ever the same. I usually start my day with checking emails. Sometimes I check the emails before I even leave the house. I'll check on my work cell phone. When I get to the office, I meet with my team, just basically talking about upcoming events and what we have planned for that day. The next thing I'll do is review recent reports, just look over our program metrics, and look up articles about new HIV advances and also community needs so that we can adjust our community engagement strategies. And then after that, if I'm facilitating a session, I work on the slides and handouts and things like that. These sessions could be at a juvenile detention center one day, the next day it could be at a community center. And basically what we do is sexual health education. And we also work on curriculum development, and that's basically creating sexual health education content for various populations because it's not one size fits all. And sometimes we also partner with our medical mobile unit to offer HIV and STI testing out in the community. So most times when you think about HIV testing, you're thinking, oh, I have to go to my doctor or go to a clinic. But what we do is we try to meet people where they are. So some days we're on a college campus, another day we might be at a health fair, another day we might be in a Walmart parking lot because you have to meet people where they are. Like I said, no 2 days are ever the same. And flexibility is key. Sometimes we have to work on the weekend, so we try to accommodate that because the needs in the community change constantly.
So many questions, but I'll put a pin on that for now.
Okay.
I'll switch to T a little bit. T, as usual, hit us with what you came up with for, the star woman for this week. So, to you.
Before I say that, Houston people, please pay special attention to this episode.
Okay. That's just stress.
It's not stress if it's
Messy,
true.
but she ain't never lied though.
Anyways, our prominent woman of the week this episode, I think it was only befitting to get to honor this woman. Her name is Dr. Makaya Duwugi. She is a distinguished medical professional with a rich personal and professional background in infectious diseases. She has roots in Côte d'Ivoire, and she spent most of her childhood visiting Africa, where she witnessed profound impact of infectious diseases. So she credits this early childhood to the reason why she wanted to become a doctor. Dr. Duwugi currently serves as the head of clinical development and medical affairs for vaccines at Johnson & Johnson pharmaceutical company. Her leadership in vaccine development has been instrumental in combating diseases such as Ebola, HPV, and COVID-19, further emphasizing her commitment to improving global health outcomes. A few things that she is noted for: she heavily advocates for inclusive research, emphasizing the importance of conducting HIV vaccine studies in communities that are most impacted by the epidemic. She advocates for community engagement to enhance disease awareness, encourages participation in clinical research, and aims at ensuring that there's a vaccine development for the needs to those that are most burdened by HIV transmission. Another area of focus for her is in addressing health disparities. Beyond vaccine development, Dr. Duwugi is committed to tackling systemic racism and healthcare inequities. She highlights the needs for strengthening data on health disparity, enhance health education, support community health workers to improve access, care, and outcomes for undeserved population. She is a recognized global leader in vaccine development, and she was honored by World Woman Hour as one of the 60 women leading change worldwide in a scientific achievement and effort to increase women's representation in science. That was a mouthful. Her leadership continues to influence the pharmaceutical industry, particularly in making vaccines accessible to underserved population, I beg your pardon, underscoring her dedication to public health and equitable healthcare solutions. Again, like I said last week, these are the people who should be your role models. I don't want to see you on Shade Room.
Are you Shade Room police now?
No, let me.
Yes, I am. Here. Because we do have all these prominent people that we should be looking up to, and we're worried about what Rihanna got on the red carpet. But I digress.
I mean, we love our good sexy red, our good sis Glorilla, you know, a little small. You know, do the little ratchets.
Ratchets don't break scientific barriers and glass ceilings. Just putting that out there.
Hey, yo.
Take that information how you please.
You have a point. So you're right.
That's hilarious. I can already see how that presidential election was getting you mad when all the people were twerking on stage. But anyways, I digress. Tutu.
Okay, so Karla, you know, as we're celebrating Women's History Month, you know, you gotta get it up for the women. We're all about empowerment and stuff like that. So, who are some women in public health that have inspired your work?
I have one. I learned about her when I was in undergrad, and her name is Dr. Adora Ademora. May she rest in peace. She passed away early last year. So she was a leading HIV researcher, and she was focused on racial and gender disparities in HIV and AIDS, particularly in Black communities in the US. And her work highlights the intersection of social determinants and HIV risk. And she basically dedicated her entire career to treating patients with HIV and also investigating the life cycle of the virus and other STIs. And her work also shed light on heterosexual HIV transmission among African Americans. And she also emphasized the role of sexual network patterns and also addressing the impact of social forces on racial disparities in the US and when it came to the HIV epidemic. So yeah, she did really, really great work.
Well, may her soul rest in peace. Shout out to you, Dr. Clink. We give it up for her, a real one. And how do you see yourself contributing to this year's theme of women educated and inspiring generation?
I see myself contributing just through the work I do by providing accessible evidence-based information on public health topics, particularly in HIV prevention, sexual wellness, and healthcare equity. And also just by simplifying health information, creating engagement patients, because you have to engage people. You can't just go and give people facts without making it fun, right? And also developing resources for vulnerable communities, because not everyone has access to the same information. And basically my goal is to empower individuals with knowledge that leads to them making healthier choices. That's just what it is at the end of the day. And through the work I do, I've realized that education is a tool for change. And by making these complex topics understandable and relevant, I can inspire future generations to take charge of their health and advocate for their communities. And even if I can help someone, just one person, make that change, then, that's always a good day for me.
That's pretty dope. Now, Karla, I know that.
See, one second, please. Before you jump in there, before you come in, I think I didn't do Karla any justice by asking her this question. Out of anything in the world, out of anything you could be, like, who wakes up and say to them, I'm going to go study to be HIV and AIDS preventionist? You know what I mean? Like,
Sounds
Like why? Like
So when I graduated high school, when I was in high school, I had, I was like, hey, I want to be a doctor, right? Everybody wants to be a doctor growing up, or almost everyone, especially being African. Your parents like, you be a doctor, this is what you're gonna do. So I wanted to be a doctor. Um, Applied to college. I got in and I was like, this school thing is hard. So I was like, okay, I'm gonna try to go into nursing. And started doing gen ed courses, and I was just like, I don't know, like I just wasn't too sure. And then I stumbled on public health. So I got into a public health program at Westchester University, which is where I went for undergrad and grad school. It's just right outside of Philadelphia. Got my bachelor's degree in public health, and then stayed at that school to get my master of public health degree. Now, when I finished school, you finish, you have a master's degree. What am I doing? Started applying for jobs. I was like, look, anything I can get in the public health space, specifically in community health education, I'm gonna do it. Within 3 months, I got a job. My first job out of grad school was as an HIV prevention counselor with one of the hospitals in Philadelphia. That's how I got into the fields, because I needed a job and they hired me. I got in there. I learned, that was probably the first time I really learned a lot about HIV in grad school. I had taken one class on HIV. It was a whole semester on HIV and AIDS. You're in school, you're just trying to pass the class, right? So with that first job, I learned a lot about the disease. And after that, I just stayed in the field. I moved on to other jobs that were in the HIV space, and here we are, almost 10 years later. That's just how it happened. I didn't go into public health thinking, hey, I want to go and work in the HIV space. I just knew I wanted to work in the healthcare space, and I didn't know what direction that was going to take me, but yeah, this is where we are today, and I absolutely love it.
Can I say something real quick, T? I know you're about to ask a question. I just wanted to, when you okay, going back to what AK was asking. So did you ever, now that you're in this space, did your parents ever think of it some type of way, why are you, or was it just, okay, I'm just in the healthcare field, I'm in that space, and it's just okay, my child is doing what or was it any why out of all things?
My parents have never asked me why. They're just like, okay, my parents are very chill, and they're the type of parents that let me do what I do and be my authentic self. There's never been a time in life where they've questioned my career choice at all. They're like, look, you're happy with what you do, you're employed, that's great, and yeah, it's never been a thing.
Okay. Go ahead, T.
Now, Karla, I know that you are originally from Africa and Cameroon, to be specific, before they come for my head. And you have had 10 years experience working in the field out of your, country, right?
Mm-hmm.
Do you have a lot of experience with community work like this with African communities?
A little bit of experience. So based on where I live, most of the other communities we work with, especially here in Texas, are the Hispanic community, and some of their cultural beliefs and norms are similar to the African communities. So the next thing I'm going to say, this is specifically for the African communities, HIV remains a significant issue. Be it in the Nigerian community, Cameroonian community, it is a big issue, but stigma and cultural taboos often prevent people from having these open discussions, right? And some of the ways that have been effective in breaking that silence is partnering with trusted local leaders. Like if there's a church that has a predominantly African congregation, you will reach out to the pastor of that church and talk to them about providing some sexual wellness education or partner with them to provide free testing, right, to their congregation members. And also framing HIV discussions within broader health topics, right? Just kind of making it more, just kind of normalizing it, right? Like when it comes to STI testing, everybody is very like scared of that. So we try to normalize that message by saying this is something that you should get done every year. Like when you go to your doctor for your annual physical, make sure they just run an STI test, like how they run every other test. They run a CDC and all of that. They can go ahead and run an STI test. And also focusing on training women and young people as peer educators, because women often influence family health decisions, right? If a husband's sick, he's only going to go to the doctor because his wife tells him to go, right? So we try to reach out to those women and make sure that they're making those smarter decisions for their families. And also moving from a fear-based approach to one that is focused on empowerment and treatment success, right? Because growing up, when you hear about HIV, you're just thinking death, like this is a death sentence, and it's not that way anymore. So we just try to get away from that fear-based approach. And another thing we do is highlighting positive stories of people thriving with HIV. There's a lot of people out there who are positive and they are living very healthy, fulfilled lives. They're getting married, they're having babies, and that's just because of all the advancements in medication and other resources that are out there for people living with HIV. And a lot of people don't know that. They still have this idea like, if I get HIV, I'm done for, I'm dead. And that's not the case today. So we just try, there's just so many different approaches that we take to approaching the African community. And one thing I know I need to do is, in my spare time, try to partner with other community-based organizations that serve the African communities to have these conversations, right? Hold community discussions, work with them to put on a health fair, provide free testing, just give them information on how to get access to free condoms. Because that's one thing. Some people are not going to go into Walmart to go buy condoms, but if they know there's a safe space for them in their community that they can access condoms at, then, that's something I can work with those organizations to make sure that they have available.
In your opinion, why do you think that HIV has such a stigma particularly with the African community?
I would say not just in the African community, but here as well, because of the way it's contracted, right? Most times HIV is contracted sexually, majority of times. And most people, when you talk about sex and sexual wellness and sexuality, it's just, in the African community, it's a taboo. A lot of people don't want to talk about their sex lives openly or what they're doing sexually. So when you contract HIV or an STI, everyone knows, like, okay, you were having sex and that's how you got it. So because of that taboo around sex, it creates so much stigma around HIV. It's just like, oh my God, it's almost like you did this dirty thing and that's why HIV. And it's like, sex is a normal part of, it's just a normal part of life. And, you are in this situation that, most people don't go out going to go contract HIV, but it happens, right? And the stigma is not necessary. Like, it's 2025. Back in the 80s, it was a big thing because no one knew what this new disease was and they didn't know much about it, and people were dying left and right. That's not the case today. So, we work every day to reduce that stigma.
I do remember also like mentioning to what you just said about it's not the 80s anymore. I remember growing up, we used to know that it's the more promiscuous people, sexually promiscuous people who used to contract HIV. And so as soon as your status is made public, they're like, oh my God, you all over the place sexually.
Yeah,
So I
and that's
think
not true. That's not true because what do you do in a situation where, let's say, a husband contracts it from his wife or a child contracts it from their mother during childbirth, during pregnancy and childbirth? It's everyone is at risk for HIV. If you are sexually active or you're someone who is sharing needles when you inject drugs, you're at risk for HIV and other STIs. So it's not just promiscuous people, because all it takes is one time. You can have sex one time and contract HIV. You can have sex one time with one person for 5 minutes and contract HIV, right? You don't have to sleep with 10 people to be at risk.
now you mentioned something that I recently started looking into, and I'm hoping that you can shed some light into. Let's talk PrEP and other preventive options for other STIs, right? But since your focus area is HIV, talk to us about PrEP real quick. Just basics, what it does, and should who should get be on the medication. It is a medication, right?
Yes, it is.
Yes.
Okay, so PrEP stands for pre-exposure prophylaxis, and it is a medication that HIV negative people can take to reduce their risk of contracting HIV. I'll repeat that again. It's a medication that HIV negative people can take to reduce their risk of contracting HIV. And when taken correctly, it reduces your risk by over 99%. So it comes in two forms. There is a pill form that you take daily at the same time. You take one pill a day at the same time every day. And there's also an injectable form that you can get every other month. So every other month you will go to your doctor and they'll give you that injection. And yeah, it is, I don't want to say it is easily accessible. It is much more accessible than it was a couple of years ago when it was developed. Most times you can go to your local health department and they can get you on PrEP, or you can find an infectious disease doctor that can write your prescription. And the thing with PrEP is when you're on PrEP, you have to go in for labs every 3 months. So they have to check your kidney and liver levels to make sure everything is okay. And then they also test you for STIs and HIV to make sure that you're still negative.
So is it safe to say that PrEP is a vaccine adjacent for HIV?
I wouldn't say it is vaccine adjacent.
Okay.
I wouldn't say that. And also, PrEP is for everybody. When it was first developed, it was marketed mostly towards men who have sex with men because that's the group that is most at risk for contracting HIV. But now PrEP is for everybody. If you're someone who is sexually active, PrEP is for you, if that's something you want to get on.
And I understand you say it's taken every day. So do you ever get
Yes,
to stop?
if you take the pill form, then you have to take it every day at the same time. If you skip a day, it's not going to work the way it's supposed to. And PrEP prevents only HIV. It doesn't prevent all the other STIs. It's just for HIV.
Talk to us about preventing other STIs.
Okay, so other prevention methods, obviously, we all know about condoms. When used correctly, they reduce your risk of contracting HIV and most of the other STIs. Now, there's some STIs that are spread through skin-to-skin contact, like herpes and syphilis, depending on where the syphilis sore is. But condoms, tried and tested, that's always, a number one option. And there's male and female condoms as well. The female condoms, they look a little different and they have a silicone ring on the inside of them. And basically the female inserts the female condom into her vaginal area. A lot of people don't know about that, but it's out there. Another prevention method will be PEP. PEP is post-exposure prophylaxis, and this is a medication that you can take within 72 hours of HIV exposure. So let's say, for example, you go out, you meet a guy, hook up with him, and then the next day he's like, "Hey, I have HIV," right? The first thing you would do is find the closest ER or the closest health department. Go there, tell them you had an HIV exposure and you need to get on PEP. And of course, it's a medication that they would put you on for 28 days to prevent you from getting HIV. Another prevention method will be using clean needles for people who inject drugs, because at the end of the day, there's people who are going to use drugs. And their drug of choice is injectable. And most times people are sharing needles and not using clean needles. Well, that puts you at risk for HIV and hepatitis C. So we always tell people, like, we can't tell people stop using drugs. People are going to do what they want to do, but we can always tell them, make sure you're using a clean needle. And if you're sharing needles, you can always clean it with bleach and hot water. Another prevention option is abstinence, right? Just don't have sex. And that means abstaining from oral sex, vaginal sex, and anal sex, because you can get other STIs through oral sex. You could get chlamydia, gonorrhea, or syphilis in your throat. And then what? So abstinence, abstaining from oral, vaginal, and anal sex.
Now, from all the preventative methods that you've mentioned, there's something that I gather from it. There's both preventative methods for, especially for HIV, where you're proactive with it. I mean, all preventative methods are proactive, right? But HIV specifically is extra proactive. And then there's also the post-exposure, like you mentioned. So that gives people a lot of options to be able to, take care of their own health in their own hands. Now, there's a saying that says that your health is in your hands and not your partner's. Is that a philosophy that you subscribe by, and why?
I do, because at the end of the day, you have to take ownership of your own health. Like, you have to take care of you. You can't depend on someone else to take care of you, right? You have to be in charge of your health. You know what's going on with your body and you need to protect that. So with us, what we usually tell people is you need to get tested regularly for STIs and HIV instead of assuming your partner is safe. You might be in a relationship and think, okay, it's just me and my partner. Well, you're not with them 24/7. So you have to take care of yourself. And then also using protection regardless of your partner's assurances, right? Because what's the one thing people always say when it's time to have sex? Oh, I don't want to use a condom because it doesn't feel right, right? It doesn't feel good when I use a condom. Well, we need to go get tested together before we take that step. Because the person might tell you, no, I'm clean, whatever, I don't have anything. You don't know that. I can't look at you and say, oh, okay, you don't have an STI or you have an STI. No, we can go get tested together, because I'm trying to make sure that I keep myself okay, right? I don't want to be sick. I don't want an STI, and also, it's up to you to understand your own risk and work on your own prevention strategies rather than relying on someone else's knowledge and decisions. And then another thing is also prioritizing your boundaries and communication. So feeling empowered to ask your partner about their testing history without fear or without feeling guilty. And also being comfortable to say no to unsafe practices, even in committed relationships. Like I said, you're not with this person 24/7. And basically, this whole philosophy of take charge of your own health, it shifts your mindset from passivity to empowerment. And it basically ensures that you are taking charge of your health rather than leaving that in someone else's hands or the healthcare system or society.
So, real quick, for people who are in a committed relationship that want to stay up to date with their STI status, what's a suitable time frame to get tested, the frequency?
So I would say to get tested every 6 months or at least once a year or as often as you change sexual partners, right? If you're someone who has a new partner every 3 months, then you should be getting tested every 3 months. If you're someone who is in a committed relationship and you're like, you know what, when I go do my annual physical, then I'll just get a test, then you should go ahead and do that. But you should try to get tested at least once a year.
So before I ask, going back to engagement, I wanted to just, so for the PrEP and the PAP, you said, so for the PrEP, is that something you would recommend people doing? Because you know what's crazy, because like whenever I go to like my doctor or whatever and I do like my annual checkups and stuff, they always bring it up, right? But then when they describe it, like the way you broke it down is not the way that they break it down. So it makes it seem like as if it's like okay, do you want to, like, you have, I mean, granted you have the option to take it if you want to, but the way when you're describing it is now like, oh damn, like I'm really just looking out for myself, you get what I'm saying, and like my potential or future partners or whoever the situation is. So would you recommend somebody getting on it just so they can, you know, have the preventive measures, or is it just like?
Yeah, I mean, it's all about having choices, right? There's other prevention methods, and if PrEP is your, choice of method, then I will recommend that. And obviously, you make that decision based on your own perceived risk, right? If I'm like, hey, I'm kind of out there in the streets and I have multiple partners, I feel like maybe this extra step is going to protect me, then that's something I would tell you to look into. It's just based on your own perceived risk.
Okay. And then for PAP, you said if you were exposed to somebody with HIV or HIV in general, what is the percentage of, because you said you had to do it for 28 days.
Yes.
So what's the percentage when you do that 20? Is it like a 99.9% or it's still like a possibility, like, okay, you take the medication, you could?
That number, I don't know that number off the top of my head, but I can always look it up and I will send it to AK and he can kind of throw it in there. But for most of the cases that I have been familiar with, it's been very effective at preventing that person from seroconversion. And seroconversion basically means going from HIV negative to HIV positive. So it's been very effective, but it has to be started within 72 hours of that exposure. The earlier, the better.
Gotcha.
Kind of like, with
birth control. So what is
Plan B? Plan B. Plan B. Look, that's a 72-hour window.
Like
after that, anything can happen.
Yeah. Okay. Just one. Okay. Thank you for that. So going back to community engagement, and I know that you mentioned that you guys like meet people where they're at. So how do you guys go about that? Like, how do you decide, okay, this is where we're going to go? Because sometimes you'll see people at like maybe the Walmart, or maybe sometimes you'll see them at some churches and stuff. So how do you come up with the locations? And then how do you tailor your demographic or your approach to reach out to those people?
Okay, so sometimes we go based off of the data we have. The data we have is broken up by zip code, age range, race, ethnicity, all of that. We look through the zip codes in the county that I work in, and the areas that have the highest rate of HIV infections, that's where we focus all of our, most of our efforts on. And then when it comes to actually going to these events and doing testing and all of that, we partner with community-based organizations. They might be having a health fair. So we make sure that we are present. And we partner with our mobile unit to offer testing. Sometimes we partner with a church. The church might be having a health fair, or they just want to do a health program. And they're like, hey, can you come? Can you do some education? And can you do testing? We do that as well. And then we also do some work on college campuses. And with that, we provide testing and education as well. And we also try to incentivize testing. by giving out, sometimes we give out gift cards, sometimes we give out program swag like bags and cups and just different little things that people like. Um, and yeah, it could be anywhere. We are all over the place. Sometimes we do work at the juvenile detention center. This Saturday, there's actually an AIDS walk event, which is an annual event just that's put together by one of the organizations in Dallas. Um, they have a walk, there's going to be a health fair, there's going to be testing there, and just other organizations and people in the community coming together just to celebrate people thriving with HIV and promoting testing and education and just basically keeping the work going.
Okay. So what are like the reactions that you get when you are conducting these engagements? Because I can tell you, for example, like I said, I can go to a store and it might be like a church passing out flyers or something, and I'm gonna walk right past you. Like I'm not even about to, or I put in my headphones, don't talk to me, please. Like, so what are the reactions? Do you actually have, I know there are some people that come up to you and be like, okay, I want to do this. And I know the like rewarding them with incentives also is a really good thing, because if you don't go ahead and pay me $50 to take this STD test, and I'm gonna take it, you know what I'm saying? So like, exactly. What are the reactions when people see them? And what are like some challenges that you went through while conducting these engagements?
I would say the reactions can vary widely depending on the community that you're working in, the level of awareness, and also cultural context. Some of the typical responses is like many people appreciate the work that we do. They're very open, and we have judgment-free discussions. And of course, they ask us very thoughtful questions, especially when we're presenting this information in a relatable way. And then some communities react with discomfort or denial. Some communities just is like, look, this does not exist. I don't want to talk about it, especially when you're talking about sexual wellness and STIs. It's like, we don't want to talk about this. Sometimes we have some issues with the faith-based communities because, again, this is church, right? And church is like, we're not having this conversation. Some churches welcome us with open arms, and then other churches, when we reach out to let them know what we do and try to figure out how we can partner to provide some of our services to their congregation, they're just like, no, like we don't need that. If you have anything on diabetes, high blood pressure, we'll take that, but leave the STIs out. But this is part of health, right? If you want to make sure the people you care about in your congregation are well, then that's everything. That's their entire system, not just their heart or, their liver or kidneys. It's everything. So it's a mixed reaction just based on who you meet. But yeah, and of course the famous one when we go out and we let people know, hey, we're testing. There's a lot of people, oh, I'm married. I've been married for 30 years. I don't need that. It's like, yeah, actually you might, because you don't know. You just don't know. And what was the other question? You said challenges?
What were the challenges?
Oh my God, there's a lot of challenges. The first one, of course, is stigma, trying to overcome stigma. Many people are still hesitant to talk about HIV and STIs due to shame and fear and cultural taboos. So what we try to do is we try to create a safe space, and that takes time and trust, right? So we try to build that trust. And also give them time. It's not, I don't expect to just walk up to someone and start talking about their sexual health. We give them time. And then another thing is misinformation and distrust of the healthcare system. So there's a lot of myths and misinformation out there when it comes to HIV and STIs. Like some people still think you can get HIV from sharing a cup with someone who is HIV positive. That's not true. And then there's also communities that have historical medical mistrust, especially the Black community. And that just requires consistent interaction with them. Another one is sustained engagement. One-time events are helpful, but in order to have long-term behavior change, you have to continue doing ongoing education and having these events frequently in the same place. And then there's also resource limitations. Many communities lack access to affordable testing options, treatment, and prevention resources. So that can be frustrating when we do this education, but there's not available services. So we try to make sure if we're doing the education, like, hey, we want you to get tested, we have testing right there. So you're not having to go figure it out by yourself. And then there's also some pushback from certain institutions, certain schools and churches and other organizations may be resistant to open discussions about sexual health. So that requires like a lot of strategic planning on how to gain access to those communities.
Perfect segue to my very next question. You mentioned time, misinformation, myths, programs, sustained engagement, resources, limitations, pushbacks.
Yeah.
Please, good characteristics of our present president. How does this guy, or our present president, right? How does his executive orders and everything impact your program, ending the HIV pandemic? If you could talk about the program and then how, all of these executive orders, affect your program, that'll be great.
What's actually funny? The program that I work for was actually created by our current president back in 2019. So he put funding aside for this particular program. The program is in, I think, at least 57 jurisdictions across the United States. So it's not just in Dallas. It's in Houston, San Antonio, New York, like all of the major cities and states and stuff. So he created that program in 2019. The program broke ground and was started in 2020. And it's basically a 10-year initiative to reduce HIV infections by 90%, ensure that 90% of people who are positive are in care and they stay in care, and then also ensure that 90% of those people who are in care achieve viral suppression. That means the HIV virus is suppressed and they can't transmit it. So he started that program, and it's supposed to go from 2020 to 2030. Right now, we are in the fifth or sixth year. And with him coming back in office, we are not sure what the future holds. So right now it's just a wait and see situation. So yeah, that's where we are. From what we know, what's been in the news, he's already cut funding for international HIV programs, which is a shame, but we just hope there's a way forward.
Your program, is it directly affected by his presidency? Because I remember you mentioned you on a state level. Like, could you talk about, for those who don't understand, separation of powers, right? Like, how does that work?
So I'm on a county level, and we get money from the state. The state gets money from the federal government. So if at some point he's cutting funds or eliminating funds on the federal level, then eventually it's going to trickle down to these local county and city programs. Because if you're cutting funding from a state, then that means the county programs are affected and city programs are affected, because that's where we get the funding from to do the work we do. So we just have to wait and see what they're going to keep or get rid of.
Yeah, so and it's funny, I've seen a list of names he didn't want government employees to use.
Yeah, there is a long list, and where I work, we haven't been told differently, so it's still business as usual where I work. Nothing has really changed, but I think when it comes to putting out any official documents or anything like that, let's say they're applying for funding for more programs, then they have to be careful with the words that are being used, because once those words are in that application, it gets scrapped. But when we go out into the community, we're still using the words that we have to use. Yes, we still have to use those terms because that's just what we're used to, and we haven't been told otherwise. So until they tell me you can't use words like advocacy or equity or anything like that, then I'm just going to carry on as usual.
Got it.
You've been in the business for 10 years and counting, right? How has conversation around sexual freedom and responsibility evolved, during the course of your career?
It's evolved significantly. So the messaging around HIV and STIs in general have moved from fear to empowerment, like I mentioned earlier. Earlier discussions were heavily fear-based. Like you could see a message that said, if you have sex, you'll get an STI or you'll get HIV. And now the focus is on empowerment, harm reduction, and informed decision making. So what we're trying to do is just letting people know, hey, here are different options that you can use to protect yourself and your partner while enjoying a healthy sex life. And then with us too, the greater focus is on pleasure and consent, right? The conversation around sexual health has expanded beyond just risk prevention, but now it also includes pleasure, consent, and bodily autonomy. More people are recognizing that sexual health isn't just about avoiding STIs, but it's also about being safe, having a satisfying and consensual experience. And then also too, there's been changes in technology and access to information. With the rise of social media and dating apps and telemedicine, it's changed the way people access sexual health services and education. And also, while this has increased awareness, it's also spread a lot of misinformation that needs to be addressed, right? So for one, great article out there that talks to you about preventing STIs, there's another one that's, just opposite of that. And then we're also starting to have more inclusive conversations, right? It's not just about heterosexual people anymore. Now we're having discussions that include the LGBTQ plus community. We're talking about PrEP, and we're also addressing reproductive justice. So the narrative of shifting these discussions to include all identities, like it's changed over the last 10 years.
What are some of the misconceptions or myths that you encounter when you're having conversations about sexual health? And what age groups do you get the most resistance or the most myths around?
We get myths and misconceptions from all age groups, right? People have different levels of literacy and people have different levels of awareness. Some of the myths, I'll just mention a few. Some people feel like you can just look at someone and tell if they have HIV or an STI. That's not true. Many STIs are asymptomatic. You might have an STI and not know because you're not going to have any symptoms. I always tell people the main symptom of an STI is no symptom at all. Most people have chlamydia and don't even know they have something going on because you might not have symptoms at all, which is why regular testing is very important. And then, of course, there's the one we discussed where it's like, oh, only certain people get HIV. If you're promiscuous, you're going to get HIV or STIs. Anyone who is sexually active can be at risk, regardless of your gender, race, age, or relationship status. A couple of years ago, I worked for the state of Texas as a disease investigation specialist. And basically what we did was investigate cases of STIs and HIV. So in case y'all didn't know, if you test positive for an STI or HIV, it's reported to the health department in the jurisdiction that you live in, and it has to be investigated, especially HIV and syphilis. And the reason it's investigated is because they need to make sure you get on treatment, and if you have any other partners that may have been exposed, they can get tested and treated too. A couple of times we had some cases where a patient is like 80 years old and they're in a nursing home, they tested positive for syphilis. Well, People in nursing homes are having sex. Don't count them out. They might be old, but they're still getting it in. And because people of a certain age group, older adults, might feel like, okay, I'm not at risk for pregnancy anymore. I can't get pregnant anymore, so I don't need to use condoms. Well, we're starting to see a rise in STIs and HIV in the 55 and up population. So again, anyone who is sexually active is at risk for STIs. And then there's another one. Some people think because they're on birth control that can, protect them from STIs, and that's not true. Birth control prevents pregnancy. It doesn't protect against STIs. And another one is, oh, my partner got tested, so I'm good. I don't need to be tested. No, your health is your responsibility, right? That person got tested, you need to get tested too. And just these misconceptions basically highlight the need for accurate stigma-free education and just basically tailoring the message to that population and just, giving them information in a way that they can relate to it.
So what resources can you recommend for people who are getting out of that? My words just went off. Who are trying to learn more about sexual education and break those myths?
Some of the resources, the biggest one is the CDC website. There was a lot of information on there on HIV and STIs and prevention and treatment. Some of the information is still on there. So you can start with the CDC website. When you go on there, there should be a search bar, and you can just type in HIV or you can type in STIs and it'll bring up a lot of information. Another place, a great resource is your local health department. A lot of health departments have sexual health clinics that offer free or low cost testing, and it is confidential. There was also the HIV.gov. That's a website that is dedicated to all the HIV efforts around the US. That's a great resource if you want to learn specifically about HIV. Or you can just ask me.
Okay, so what would you say to someone who's afraid to get tested for STIs or HIV?
The first thing I usually try to do is acknowledge that fear. It is completely normal to be scared. The first thing, some people are scared of needles because that's the first question we always get, like, oh, do they have to stick me with a needle? And it's like, yes, they do have to draw blood. It is almost painless. You might feel a little prick, but some people are scared of needles. And then there's another group of people who are just scared of the unknown. Some people have never been tested before, right? And there's just that there's just that hesitation, right? It's like, I don't know if I want to find out, because what if I have something, then what? So we try to let them know, like, hey, if one of your tests comes back positive, we can help you get treatment. All right, because that's what we do. We're going to test you. We're going to make sure you have treatment. So another thing I tell them, knowledge is power, right? No matter the result of your test, knowing your status puts you in control of your health and your future. And also by letting them know testing is easier than ever. Many clinics or doctors' offices offer quick, painless tests, including rapid HIV tests. There's a rapid test out there. It's a finger stick. You can get your HIV result in 1 minute. And then there's also a mouth swab that you can actually get online for free. It'll be mailed to your house. When you get it, you swab your gums, put it in a solution, and within 20 minutes, it can give you your HIV results as well. And then also just letting people know most STIs are treatable. There's a lot of effective treatment options. Like chlamydia and gonorrhea are completely curable. With HIV, you can't cure HIV, but there's treatment for it to keep the virus under control. And eventually you get to a place where you are virally suppressed, and that means you can't transmit the virus as long as you stay on that medication. So medication adherence is important. And then just letting people know you're not alone. Testing is a normal part of healthcare. It's just like getting a diabetes check or a blood pressure check. And also letting people know support is available. Support's available out there. If we're at a community event and someone comes to our mobile unit and they feel like they don't want to go on that mobile unit alone, we can go on there with them and hold their hand through the process. Right? Or if you want to bring a friend to get tested with you and provide that support to you, then you can do that as well.
I'm glad that you said that whole like being on medication and then like the chances of passing up, because this has been a conversation a lot where people will be like, okay, I have HIV or I have herpes, but because I'm taking the medication, it's not detectable. And because it's not detectable, I don't have to go ahead and tell the person that it's detectable. Like, how do you feel about that conversation? Because I know that's a whole like back and forth thing. Is like, okay, well, if I know I'm not passing off the virus, then why do I need to go ahead and tell people? But like, what do you think about that?
For me, the decision to disclose your HIV status is a personal thing, right? But I would say this, if you're in a relationship with someone or, your sexual partner or y'all are just friends with benefits, there's a little part of you that cares about that person. And, I would hope that you would want to let them know what's going on with you, just so they're aware. But again, it lies in the hands of the person. Like, that's your personal decision if you want to disclose or not. Some people do, some don't. There's not much we can do about it.
But if they aren't undetectable,
Mm-hmm.
that whole, because you can get sued or you can go to jail if you pass a STD and you knew and you didn't tell nobody.
Yeah.
But if you're undetectable, but then something comes to play, then how does that go about?
The legality around that, when it comes to suing someone for transmitting HIV to you, there's a lot that goes into that, because you have to prove that you were being sexually active only with that person. And then you also have to prove that the person wasn't virally suppressed, and that's how they transmitted it to you. It's a lot that goes into that. It's just, yeah, it's a very sticky situation, because again, you can come and just say, oh, well, you gave me HIV. I don't know that.
Right.
I don't know who else you were sleeping with. And also, too, I've been on my medication. Maybe I skipped the pill for a couple of days and now, my viral load crept up a little bit. But now I've taken my medication, it's gone back down. So you can't prove that I gave it to you, because so there's just so much that goes into that.
Right. I know, because that's a really big, like, I feel like I log onto Twitter all the time and that's like the conversation at hand is like, okay, well, you knew that you still had it even though you were undetectable, and you still should have just told your partner, or at least let people know and stuff. But like you said, to each his own preference.
And there's actually this thing called U equals U, which means undetectable equals untransmittable, right? So again, the person has to be taking their medication. So take your medication as prescribed so that you're undetectable. And when you are undetectable, you cannot transmit the virus as long as you're taking that medication. So you can't say, oh, I'm gonna take it for 1 week and then skip a day. Like, that just puts you in a very bad place, because what happens is at some point you keep skipping that medication. Now the virus becomes resistant to that particular medication. And now you have to go back to your doctor to get you on something else. And eventually, if you keep doing that, you become resistant to all the available class of HIV drugs out there. And then there's nothing to help you anymore. And then what?
And now you're just stuck.
Yeah, now you're just stuck, because guess what? It takes a lot of money and time and research for a pharmaceutical company to develop a new drug. It's like over $1 billion just to develop one drug. So they're not about to go back in the lab and say, hey, this one person is resistant to all the 15 different options out here. Let's make something new for them. No, that's not going to happen. So we always tell people like, hey, like you need to take your medication as prescribed. Same thing with STIs. You have chlamydia and gonorrhea, and they give you your antibiotics, and you think, oh, okay, I'm gonna just take it for 3 days, and then I'm gonna save the rest of the pills for next time. You can't do that because at some point you're also gonna build resistance because there are resistant strains of gonorrhea and chlamydia out there. So taking your medication, whether you have HIV or STIs, or it's very, very important.
That saving for next time is crazy because there are some people that really will do that and be like, okay, well,
no, they give
That's
you
true,
7 days worth of meds for a reason because they've done extensive research over the years, and you need to take it for the full 7 days. You need to take every last pill. You can't skip doses, you can't do that.
More of the story, let's just not have sex. Like, let's just keep it cute.
We can't tell people that. It's part of
I
life.
mean, you're right. We
People
can't.
are gonna keep
Protect
doing it.
yourself.
Yeah, protect
and
yourself.
be
There's
cautious.
a lot of different prevention options out there. Find the one that works for you and your sexual partners.
Yeah, just be cautious because, like you were saying, them people in them nursing homes. When I never believed it, but my mama used to tell me when I'm like, oh no,
Yeah.
like but that's where a lot of those STDs and STIs are actually like coming from. I'm just like, oh my God, y'all are.
Yeah, and the reason too for that is that's a population that's very forgotten when it comes to sexual health. Because like, oh, you're old, you're not doing anything. I said, no, people are still active. People are very, very active. And because that is a population that is ignored and no one pays attention to them, the rates in that age group, 55 and up, are going up. Those rates are increasing when it comes to STIs and HIV.
Ooh, I'm learning, man. Okay, before we wrap up, what keeps you motivated in the field despite the challenges? Because I know, child, there's a lot of challenges.
Oh.
How do you get up and be like, you know what? It's another day. I need my job. I need some money. How do I keep pushing forward?
Despite the stigma and misinformation and the systemic barriers, I stay motivated because the impact of the work that I do is real. Every time someone gets tested or they start on PrEP or they learn about the different prevention options, that's a step forward, towards better health and fewer infections. And then also too, just fighting stigma saves lives. I strongly believe that just changing the way people talk about HIV and STIs directly influences whether they're going to seek care, disclose their status, or advocate for their health. And then also too, the people I work with inspire me every day, whether it's the healthcare providers, community advocates, or people living with HIV who share their stories. I'm surrounded by people who are very resilient and dedicated. Like it is a lifestyle for us. It is. We, even in our spare time, we are out there supporting each other. If there's a community-based organization that has, let's say, an empowerment brunch on the weekend, that's not work hours for me, but I'll go to support because those are the people that we work with. We don't do the work alone at the health department I work at. We work with these other organizations because we can't provide all the services. We have limited resources, so we have to partner with other organizations and other people to keep this work alive. We can't do everything at all. And because of them, they keep me going. And also too, there's a lot of progress. There's been improvement in treatment. There's so many different public health initiatives. There's many cool ways to do what's being done, right? When it comes to education, we're finding different ways to educate youth because historically you would get sex ed in school, right? Well, we live in Texas, and Texas is a conservative state. So sometimes the curriculum doesn't address everything that it's supposed to address. So we find other ways to get in touch with youth. So we can partner with organizations that serve youth primarily, and we can just have like a sexual health education class. Another cool thing we've been doing is going to the juvenile detention center in the county where I work. We go every week and we provide sexual health education classes to the youth there. So yeah, there's a lot of progress and there's just so much that we're doing out here. It's not a one size fits all. So we always work to tailor a message to different populations, and the work is tough. It is tough. You don't get in this field to make money. You get in because you really want to help people. It's not a money making field, especially if you're working in government. You're not in it for the money. But the victories, big or small, make it worth it every day. Mm-hmm.
What's next for Karla, MPH, CHW, HIV, PNC?
For me, I don't know. Just keep doing what I do, keep doing the good work. I had thought about going back to school, but that's expensive. If anybody wants to pay for it, please let me know. Contact me and pay. I'll go back to school. And hopefully in the future, down the road, maybe I'll be able to start, my own little nonprofit organization. Who knows? But until then, I just keep doing the good work and helping people.
In an ideal world,
Mhm.
what would be your vision vis-a-vis HIV and STI prevention?
For me, it'll be a place where testing and treatment are normalized, right? Getting an STI test should be very routine, right? To me personally, I don't think any medical provider should tell their patients, oh, you don't need that test. Because sometimes you might be someone who is married and you go to your doctor. That's a doctor you've seen for 20 years. They know you're married because your husband or your wife, your spouse is also their patient. So they might tell you, oh, I don't need to test you for STIs. No, it needs to be part of your routine checkup without fear or stigma. And also, I envision a world where healthcare is truly accessible. Everyone, regardless of income, location, or identity, should have easy access to healthcare and prevention tools. And also, just making sure education is readily available. Comprehensive, inclusive sex education is important. It should be standard so that young people can grow up with the tools that they need to be empowered and make smart decisions. And also just to continue engaging with community, solutions need to be community driven and not individually driven. You need to meet people where they are. You need to make sure the information you're giving them is culturally relevant and judgment free.
Last question here before we
Yes.
close out. They say charity begins at home.
Mm-hmm.
So, being that you're Cameroonian, I remember one time there was news that Cameroon community in DC area, Texas area,
Mm-hmm.
have a prominent.
Especially Maryland. Oh my God, Maryland always gets a bad rap when it comes to that. It's like, the Cameroonian population in Maryland.
But how do you plan, or how have you impacted that community, if you have?
I would say I am someone who is always excited to tell people about the work I do. I can talk about it on and on for hours. So my face always lights up when I meet another fellow Cameroonian and they're like, oh, what do you do for work? And I'm just like, wait, let me tell you, right? So just by letting people know about the work I do, I feel like I'm making a difference, because a lot of people don't know that there's these jobs out there. People don't know that there's a group of people that investigate HIV and syphilis cases. They don't know that there's a group of people going out there and making sure people are getting tested. They don't know that there's a group of people going out there and providing education in the juvenile detention centers or on college campuses, right? So just by letting people know what I do, and just letting them know, hey, if you have any questions, hey, you want to get tested, let me know. I can make that happen. I can tell you where to go. If you test positive for an STI, look, You can talk to me, you can trust me, everything's confidential. I will tell you where to go. If you need condoms, you need free condoms, let me know. We have a lot where I work. I can get some to you. If you don't want to go into a clinic to get an HIV test done, I can tell you where to go on the internet and get a test kit that you can use at home.
Do you have a
So-
website where people can come and find some of this information?
There's a lot of websites. If you go, there's one. This is one of the organizations that we partner with. It is freelux.org, freelux.org. Shout out to Nathaniel Hawley. He is the CEO and founder of that amazing organization. You can go on there. There is a link on his website that says Lux Test, Lux Test. If you click on it, it's going to ask you for some brief demographic information. When you enter that in, it's going to ask for your address. You put that in, and then he's going to mail a testing kit to you. And that's the Oral Quick test. It's a mouth swab that you can use to test yourself for HIV at home. And when he mails it to you, there's also information on resources in your area
Nice.
when he sends a test to you.
Nice.
Or, if it's not available, you can just Google at home HIV test kit, and it'll bring up a couple of other organizations that can provide that.
How can people connect with you since you say if they need condoms, they can reach out? Somebody from my
You can message me on Instagram, Karla B89. KarlaBee89. You can shoot me a message and I'll work with you on getting those condoms. And if you're someone who lives in the Dallas area and you have a nonprofit organization or there's any public health work that you do and you want like a box of condoms to be able to distribute to the people you work with, you can reach out to me as well.
We're not here now. We're not here.
Yeah. Also, too, hey, if you want to, put together a testing event in Dallas County or Denton County or Tarrant County, let me know. If it's in Dallas County, I can make that happen. If it's in any of the other counties outside of Dallas County, I can link you up with some of my other colleagues that work in those counties, and we can put together a little testing event, a health fair, an education session, or anything like that.
You know what I just thought about?
What?
She has too many condoms. Can we do condom giveaway on Palm Wine Central?
Wait, what'd you say?
Can we do a condom giveaway?
You're doing a condom giveaway. Hey, there's a lot to go around. We have a lot. We have a whole lot. It's free. It's free. Sometimes people don't have that $10 to go to Walgreens and get condoms. But you can walk into any health department and get it for free. No questions asked.
Yeah, so
now it might not be the luxury ones you're used to, but at least it's something.
It's functional, right?
Yeah, you might get some Trojans instead of skin, but at least it's something.
If you ain't got the money for it, you shouldn't be having sex. That's just that. Simple. Okay. Oh, it's me. Okay. All righty. Do you want to close out with her or do you just want to? Okay. All right. So usually, Karla, I have a word of the week where I go ahead and I choose a word and I basically give like the definition, the pronunciation, and I'm using it in a sentence. But today I'm going to switch it up. So we're going to do like what would Jesus do? But we're going to do what would Palm Wine Central do? So somebody is going to ask for our advice and feel free to chime in too. And we're going to basically give them advice on what they should do. So this is the scenario. Okay. I have been married for 7 years and my wife is tripping right now because the woman that I was engaged to prior to our marriage, she broke it off because I had cheated on her, tragically passed away over the weekend. And her family invited me to the homegoing service to be on her program. Me and her family were really close, and I've kept in touch with them over the years. My wife does not know how close we've been all this time. I haven't told her about the invite because she never liked my ex. I think it would be rude of me to not show up, but I think it's going to be a big blow if I go. How do I get her to understand that she needs to be the bigger person about the situation? So for people that didn't understand, he's married now. He had an ex that he cheated on before she passed away. The ex passed away, and now the family's asking him to be on the program, I guess basically to speak. But his current wife does not know that he is still in communication with the deceased ex's family. So he wants to tell his wife, but she doesn't like the ex. So she never liked the ex. So he's like, what should I do? Should I go? Should I not go? Or should my wife just be the bigger person and take it as it is? What y'all think? Oh, me or Karla? Who gonna start it off? Karla, what you think? You are our guest. Go ahead. What you think?
Oh, that's a sticky one. See, if it's me personally, I wouldn't care because that's just the type of person I am. I'm like, look, I don't like stress. If you want to go, go. Like, she's dead. Like, I'm not threatened by that, right? We're married. She passed. If you want to go pay your respects to the family, that's fine by me. At the end of the day, you know your wife better than anybody else. So if you know it's going to make her upset and cause problems in your marriage, then don't do it. You know your wife better than anybody else.
So if your husband was like, okay, babe, I'm about to go to my ex's funeral, even though I know you didn't really fuck with her, you didn't like her, what do you think about that? Like,
she's dead.
Oh, okay.
She's dead. I'm not threatened by someone who is about to be put in the ground. I'm just I mean
that.
I don't mean to sound insensitive, please. I'm not insensitive. But you know, it's facts, right? And he probably stayed in touch with her family for one reason or the other. That's okay. People have their relationships. I'm not gonna come in and make you break off relationships because I'm with you. You have some of those relationships for a reason, as long as they are respectful of our marriage. And you going to someone's funeral, you have to pay your respects. That's fine by me. But again, he knows his wife, and if she's going to blow a fuse, then do not go. You can send some flowers or something and a nice card and sit in your house and protect your marriage.
Thank you. Anybody else? Who else? See, anything?
I mean, I feel like if you have to keep a relationship a secret, then there's an ulterior motive to it. That's just how I feel. If you're about to hide the fact that you have a relationship with someone, and if it really is platonic, like you say it is, it shouldn't be a secret. Now, I don't have to like this person, and I don't have to understand. But if you're hiding that, then there's a problem.
AK, what you think?
I don't even know what to think in this situation.
I know. Let's hear from the guy, because that was a guy's question.
Right. So, like, if your wife is like, I don't like her and whatnot, what are you doing?
First of all, why is my ex family inviting me to a funeral?
Because that was your ex fiance.
Reason why they said ex.
I mean, you were still in touch with her family. You were the one talking to them. That's why they invited you.
Yeah, that's that guy, right? It cannot be me.
Yeah.
I just don't see how that's me. You know what I mean? I just don't see how. But in that situation, well, I don't know, man. Like, why is he going there first? You know what I mean? Is he trying to be done with his wife? Because I feel like
he died. Somebody died.
Somebody died? Is he the only person? So without him there, the funeral will not go on, right?
I mean, and I asked this question solely because we literally asked this question today, and we were all stuck like the person is dead. Like, what are we supposed to?
Wait, hold on, time out. Because I can see this in many different ways, right? From my perspective, let me ask this question. First of all, keeping up with the family is a whole different thing. Now, keeping up with her is a whole different ballgame. You know what I mean? Now, keeping up doing what? Talking about what? Why?
But the question said he was still in contact with the family.
With the family. Mind you, she passed away. So, yeah.
It doesn't mean he was in contact with her.
She's dead.
I mean,
It's just a family.
if they ask me to come there to say one or two words,
No, that's a lot.
yeah, it's a lot.
Better
Man.
go and sit.
But
Better
they
go and sit
asked
in
him
the
to be
back.
on the
See,
program.
I'll tell you this. If the family can invite him, it means she never told them why they broke up. Because there is no family that would invite you to the funeral knowing that you cheated on their daughter and that was why you guys broke up.
That is true.
So she never told the family, and so the family still thinks, like, hey, you almost had a life with this person. They passed away, almost kind of honoring both what they shared. But I don't think she told them. If she did, there would have not been an
That is true.
You do have a point. I didn't think about that. You do have a point.
Families, they are ride or die.
Yeah. So
your
if
partner
you cheat,
your partner has enemies. Because
yeah.
I know my family. You do something to me, do not even like.
So first of all, let's address something, right? Because there's this thing, like, I mean, understand that you don't get to tell people who they can be friends with and all whatnot.
Yeah.
Let me shoot this. Let me introduce you to a girl I'm dating. Let's break up, and you, my sibling, decide to go have a friendship with her. Try that. You get your own person, and I'll show you what it means to invest in somebody else that you don't like, because that's madness.
So wait.
No, it's not. Then you're just gonna hate my whole family.
Hold on, wait a minute. Wait, if you break up with a girl and then your sister now goes and befriends your ex, that's a problem?
To me, it's a problem. I'm not saying that she doesn't have the right to. You understand? I'm not saying she doesn't have the right to, but you also got to understand this. 9 out of 10 times when we're together, the siblings are always the people to always come and tell you, yeah, this, da, da, da. Oh, so now that we're not, you're forgetting that you were the person talking all this shit, and then now you guys are friends. Anyways, for me, just keep it far away from me. You know what I mean? I don't need to know this. I don't want to know. I don't need to know this, because my siblings' exes, I have no business with them. You know what I mean? For me, it's a principle thing. So if I'm giving you that courtesy, you gotta give me back. I don't care whether you think that you and this person are all of a sudden besties. Yeah, no. Especially if I'm the one who introduced you to them. Oh, now you mad. Right? That's just
me in that situation. Look, it's a funeral. Send some flowers and a card and sit in your house.
Don't send nothing.
To avoid stories that touch. Send flowers and sit in your house. You don't have to. If if it's gonna cause problems in your marriage, then your marriage is priority. Technically, you don't owe those people anything. They invited you, respectfully decline and keep it moving. At the end of the day, you're not the one who killed the person, and y'all didn't have any relationship at that moment when they passed. So
if the man goes, the man was done with his wifey. This is all I'm saying. The man was already done. You know what I'm saying? Like, he was done. If the man went, he was done. No, to me, no questions asked.
That's true.
At the end of the day, you have to know your partner. You have to know your partner. Like in a marriage, these are conversations you have to have. You have to know your partner, and if you know your partner is not going to be happy, sit in the house. Because if not, you're just asking for problems, just creating problems for yourself, which you're probably going to regret, because you're going to be like, okay, I'm going to a funeral for an hour, and then now you have 5 years worth of problems. Because women, we don't forget. We're going to bring it up every time.
Yeah.
Every time you do something, I remember when you went to your ex's funeral. Yeah, so I would advise you, just depending on the wife you have, you might just want to stay at home.
Keeping up with the family.
Me personally, I wouldn't care.
Servicing somebody in that family. Why are you keeping up with them?
I mean, if you're so pressed to sit there and go and pay tribute, go to the little funeral home, put you a mask, put you a hat, some sunglasses, go ahead and sign the book, put your fake name, send the flowers, and call it a day. If you so pressed to go ahead and do that. But yeah, I don't know. I just, like you said, just stay home. It's okay. It's all right.
So will you guys go? If he says you should come with him, will you guys go?
Me? To do what?
Who, me? I'm not going.
I wasn't invited.
I'm not going to a funeral for someone I don't know or I didn't have a relationship with. Like, I'm not about to just.
That's okay.
She wasn't a friend or a family member, so I wouldn't go. But if you feel like you want to go, you can go. When you come back, we'll talk about it.
I have other things to do. No, I'm okay. Yeah. No, you was invited. Okay, but yeah. So yeah, that was the topic. So thank you guys for engaging in that conversation.
Yeah.
Yeah, so I want to raise my blood pressure this time. Not today, Satan. Not today. No. Anyways, appreciate you guys. Thank you all for this solid conversation. This was really good, Karla.
Thank you so much. Thank you so much for having me. This was great. I usually don't do stuff like this because I am a very introverted person. Stay in my corner, stay out of the way. For those that live in Dallas, yeah, you probably haven't seen me and you probably won't see me anywhere because I just stay in my corner. But this was great. Just, having this opportunity to talk about some of the work I do and just, sharing my experiences.
For sure. Well, I appreciate you.
Yeah, thank you.
Yes, and her handles will be at the bottom of the show notes here. How to get in contact with her. So feel free to reach out to her. Men, especially women. I've never seen a woman's condom before. So ask her. She will send maybe a sample. You could see it.
Yeah, I'll send you to the website.
It looks like a tablecloth.
Yeah, do a Google.
Actually, it is quite bigger. It's probably 2 or 3 times the size of a regular condom. It's big. It's yeah. But there's pictures and videos online. So
pretty much you know what? Let me close. What was that? What's my thought process? Anyways, T, any conclusions? Well, I find my thought process here. Any conclusions?
No, thank you, Karla.
thank you.
I don't think I've met anyone like African in the space that you're in, so it's been interesting to learn.
There's a lot of us in this space. There's quite a good number. There's people who are infectious disease doctors, there's counselors, there's case managers, educators, researchers. There's a lot of us in the space, both here and back home.
That's amazing. I did something like that before with COVID. I was a case investigator.
Yeah, I did a little.
It was hectic. So I can't imagine this on a.
I remember during COVID, it was all hands on deck. Everybody who worked in any local, state, or federal health agency was on COVID because it was short staffed, and they had contractors come on. As long as you knew how to ask people questions on the phone, they would hire you because it was so many cases that needed to be investigated, and the contact tracing and everything.
So it was scary seeing those numbers. I'm like, you get into I was in Oklahoma, then I worked for the State Department of Health, and you're like, you do not want to know how many people have COVID. Do not leave your house.
Because I remember at some point you go in and, you pull up your cases for the day and you're like, oh my God, I got to talk to 30 people. Like, this is a lot. And then when you talk to those 30 people, you might get names for other people to call their contacts. So now you have to call the contacts, and it was a lot.
All these questions. So God forbid they were on a flight. That's a whole week of work right there.
Yeah, it was a lot.
It was fun though, but I
don't
know. Kudos to you. I don't think I'll do that anymore, but
yeah, now I'm more so with education and capacity building and community engagement. So,
less tedious.
Yeah, it's less tedious. There's more variety in what I do, and I don't have to be on the phone as much. I think my work phone, my desk phone rings maybe once in 3 months because nobody calls me. They just email me like, hey, can you do this event? Can you come teach this class or do this training? So I've moved over to the other side. So yeah.
Nice. Before we go, let me ask, can someone hire you for a wedding? Come and test the guests.
You want to test guests at somebody's wedding?
No, not like voluntarily, just like, hey,
Whose wedding? They're gonna be like, what are you doing?
Just have a little kiosk over there and be like, sexual health orientation over there, free condoms, and you can get a test too. People might not come to my wedding after this.
I mean, hey, if you want to have that at your wedding, there's a lot of resources and there's organizations that can bring out a mobile unit. They'll park it right out the building. You tell people, hey, if you want to get a test.
Absolutely not. Not at my wedding. Not no mobile truck outside my wedding.
I said, no, definitely not mine. Definitely not
Oh,
mine.
ma'am.
That's the pass to the reception.
Yeah. But you could always you can host a healthcare event. If you're friends with people that work in healthcare, you can get some of them to, do blood pressure checks and blood sugar checks. You can contact someone to bring a van to do mammograms, STI testing. You know, they can provide, vision screenings and stuff like that. That's a good way to go around
That
it.
makes more sense.
Yeah, yeah. Just
Okay.
have a fun event. Yeah, and provide different healthcare services.
Well, thank you for coming
Of course.
and educating me. I learned a lot today.
Thank you guys for having me.
Yeah, this was really good.
It was great. I've been a little nervous. I almost messaged him. I was like, I don't know if I'm gonna do this.
Really? A lot of people always say that.
A friend of mine had to convince me because she's been asking me for months, like, hey, you should go on this podcast, and because you do a lot of great work. I was like, I am not a public speaker. I don't like it, even though I talk every day for work, but I'm just like, ugh. Like,
Well,
you did a really good job. Yeah,
me.
you did a really great job. So
Like,
that's how it is, though. I think also when you're comfortable with like the guests, with the host and stuff.
yeah,
better.
I almost backed out, but I'm glad I didn't.
Well, we're glad that you did it.
Thank y'all for this opportunity.
Not during Women's Empowerment Month. No,
I
man.
know.
Please do not.
Yeah, women are out here doing great things. We are a catalyst for change. And yeah, we're out here doing great things. It's Women's Health Month. All the women, go see your doctor, get tested, just
That's she bag.
make sure you're okay.
And do it right.
Yes.
Do it too. Semi-annual, what you call it, physicals or annual physicals?
Yeah, annual physicals. Yeah.
You know what I'm saying? And lastly, too, not to drag us back into it, but you did mention something when we were talking about when you go to get your physicals, you need to ask the doctors for all the necessary tests, because if you assume that they'll do it, they will not.
Yeah. Sometimes you have to ask because not all doctors are going to run STI and HIV testing on your labs during your annual physical. So you need to ask to make sure that it's included. Just tell them, can you include STI? Can you include an STI panel? And they'll run all those tests for you.
We're not here. Not here. Anyways, Karla,
Because some doctors, they just assume like if you go in there, go see your doctor, you might be 16 or 17 and you might be sexually active and your parents don't know. You have to ask your doctor. Or if you're older, you have to ask them, just let them know like, hey, can you include a test? If you don't feel comfortable asking your doctor, there's a lot of other places that you can get tested. Go online, go on Google in the search bar, just look up free STI testing near me. You can find places that will test you for free. And then there's also other places that can send you a specimen collection kit at home, or you get information to go to a lab somewhere and you pay like maybe $200. If you don't have the $200, again, go to your local health department and you can get tested for little or nothing. Some health departments might tell you it's $30 for a full panel, but if you don't have the money and you tell them I don't have the money, they'll still go ahead and test you for free. They're not going to turn you away.
Anyways, thank you. Greatly appreciate it.
Thank you.
Come again, next time. Let's do some more on this, on this topic. And listeners and watchers, if you have any questions, for the guests, feel free to, drop that in the comments, be it on all social platforms or on YouTube. We'll gladly appreciate it. This is Palm Wine Central Podcast. I'm one of your hosts, Uncle AK. Got the beautiful ladies, T, Tutu, and our guest today was East, Karla. And yeah, reach out to her, man, if you got any, questions on HIV, HIV and STIs and, all that stuff. Catch us on the next one. And we out. Peace.